back. Now, every hour, according to the World Health Organization, estimates 90 people around the world take their own lives. Now, this figure is expected to double by 2020. It's a dire situation, but psychiatrists say not all those who attempt suicide really intend to end their lives. Today, on World Health Day, we take a closer look at the warning signs and ways to help those driven towards suicide. Joining us are Dr. Srinivasa Malladi, a consultant psychiatrist at Singapore's Institute of Mental Health. Dr. Malladi, thank you for coming in to speak with us on this, an awkward subject to talk about, but something that's very important and something I think a lot of people watching can benefit from. First up, though, these statistics are quite staggering. A suicide every 40 seconds. What's driving people to take their own lives?
It's a concerning matter, of course, and it is true that evidence is pointing to increased prevalence globally. Researchers are struggling to identify the exact reasons for the rise, possibly the reason being the factors triggering suicide can often be complex. Nevertheless, if you look at some historical data, we do know that during the times of economic slowdown, recessions, numbers of suicides have gone up. Then you can see the sociologists' observations where they do identify the changes in society, the way we are leading a lot more stressful lives nowadays. Younger people are more at risk. I mean, the traditional view has always been that the elderly males have been, most at risk. But now we are seeing a different trend of younger people being more vulnerable. So I guess we can look at the fact that there are societal changes, but there's something else going on as well.
Tell us about the mental state of a lot of these people that are driven to take this way out of their problems. I mean, it's beyond desperation, right? Is there like a psychological mental state that you can describe?
Is it depression or is it psychological?
Okay. Once again, if you look at the factors, mental health problems do play a role. Often we do see social factors playing a larger role as well. For instance, things like separation from your loved ones, or sudden changes in their own living circumstances, losing employment, financial crisis. Now, these are bound to result in certain psychological turmoil and a distress, and that in association with mental health problems or even certain physical illnesses. For instance, if you look at those who have disabling conditions, stigmatizing problems, or life-threatening illnesses, where they see that there's no hope anymore. These are the factors, once again, it's a culmination, it's often an interaction as well.
We talked about the stats of 40 seconds, suicide every 40 seconds. This is an international sort of statistics, but are you seeing a difference between developed countries and developing countries in the way the numbers are sort of taking shape?
Yeah, so far, if we look at WHO data, high-income countries seem to be having a higher prevalence rate of suicide. But they also have given statistics to show that the low and the middle-income countries are fast catching up. And that's a lot more challenging because in these countries, access to healthcare isn't as good. Right. I think overall we are seeing very similar patterns. Perhaps what drives somebody to suicide may differ between these sets of countries.
Now, are there certain personalities that are prone to this type of act, or is it, impulse? What kind of reasons can we extrapolate from this? Okay.
When we understand certain factors which may lead to suicide, personality factors do play a role. For instance, as you rightly said, impulsivity being one of them, or aggressiveness. Drug-seeking behavior, some may be kind of stimulated a lot more with drug-seeking behavior. That can result in unpredictable emotions and can lead to further problems. Then those who tend to isolate themselves from others, and those who have poor coping strategies, those who find it difficult to handle their own emotional difficulties or even life pressures. I guess these are some of the personality factors, yes.
What can people do more to sort of recognize these symptoms? And if there is someone that you know that you think may be about to take their own life, or if there are people out there, you know, thinking of this as a way out, what would you recommend they do?
Like a recent example, just to piggyback on what he asked, was Mick Jagger's girlfriend, Lauren. I forgot her last name, Lauren.
The designer.
The designer, yeah. She took her life, and no one expected that. It was a true shock amongst her friends and close family. So what kind of symptoms or signs can you get?
Okay. More often than not, people around the person who has unfortunately completed suicide would have had some warnings, and some observers believe that up to 80% of those who have completed suicide have given early warnings. Now, these could
so
be...
it's rarely something that you've reacted to very quickly. It's more something that you can recognize that someone's been depressed over a period of time. That's more usual, is it?
You can have both, yes, of course. Those who have long-standing difficulties, those who are more likely to voice their expression of unwillingness to live anymore. Yes, you possibly have had opportunity to hear that on several occasions. But even then, those who have attempted suicide due to an acute crisis in their own lives, I'm sure they would have raised some alarm bells ringing. Some of these warning signs could be in the form of, verbal messages. They would have just said, oh, living is so difficult. Or they would have just bid farewell, saying goodbye. Sometimes it's more of pre-suicide preparations, giving away their favorite belongings because they don't need it anymore. Or giving away their financial assets. Searching for methods of dying. There could be another thing that they must have been actively doing during the pre-time.
This sounds like a very rational way to approach a very desperate situation. When you describe it, that people actually go through this process of thinking, one, how are they going to commit the act and getting their affairs in order? Is that quite often the case? That
it is often the case that, or at least let's say that, yes, rationality is still there. It's not to say that the person is irrational in how they see, but what may sound irrational to them, what may sound irrational to us is possibly rational to them. Often those who contemplate suicide are in a terrible state of ambivalence. They want to live, they may want to die, and so on and so forth. And they may be wavering from one state to the other. And let's also understand that it is that state of mind where living is a burden. And it's so extremely painful, the negative emotions. And sometimes it could just range from mere hopelessness, shame, guilt, anger.
So how do you help? You're a psychiatrist who deals with these situations. How do you help someone that you feel like is showing these symptoms? Okay.
First thing though, I think it's a job to kind of make sure that these persons access help and support. When a person comes to us seeking for help, which is actually surprising, it's not surprising for us, but there is a myth out there that people don't like to access help when they are in a state of contemplating suicide. So when they do access help, we do a thorough assessment. We want to make sure that we understand what's going on in their lives. We want to make sure that we understand their mental state, their social difficulties, and we assess the risk of suicide, which is whether it is imminent or whether it's something which is of a low risk. So once we do that, we are in a better position to help them, either in the form of treatment, offering counseling, or even problem solving for their practical problems.
Okay, thank you so much, Dr. Malladi, for coming in and speaking with us today. Dr. Srinivasa Malladi, a consultant at the Institute of Psychiatrist as well, at the Institute of Mental Health in Singapore, on suicide's warning signs. More people worldwide are turning to suicide as a way out, as you heard us talk about. There are avenues for help, though. If you are in Singapore, Malaysia, or Japan, you can find professional services through these helplines and the numbers that are appearing on your screen now.
All right, and that's it for us for today, Monday, April 7th. And join us again tomorrow for your regular dose of world and business news, plus lots more great stuff. So see you bright and early tomorrow. Bye for now.